You talked about how it's great at the practice that you work in that you have these other healthcare professionals to actually address not just the physical but social and mental aspects of someone's health. Do you find that health is a result of social and other issues happening for a patient, or do you think someone's health ailments is actually impacting on them contributing or functioning as a person? Where does health play its role, in the primary care level in impacting all of that? What relation do you see all of this?
Yeah, no,
Especially in people that, let's say, Newham.
yeah. Hasnain, you asked a very interesting and fundamental question. So, health is not just physical health.
Yeah.
There is a biopsychosocial model.
We learned that in med school. Yeah.
Where
Yeah.
there are various factors that can contribute to someone's health and well-being.
Yeah.
We call that the wider social determinants of health.
Yeah.
So how you feel day to day is determined by, your day-to-day physical functioning. For example, what your blood pressure is like today, what your heart rate is like today, specific medical conditions which we can diagnose, pick up with blood tests and examination. But your health is also determined by your mood and your mental well-being, which is also impacted on wider social factors. So in a community like Newham, where we have a very large population that's growing, it's predicted by 2030 that there'll be a 90% increase in the population of Newham. We've got a lot of people here. In addition to that, we've got people who are socio-economically struggling. We've got a cost of living crisis, which means people are unable to buy goods that they can, usually a huge amount of inflation, so people can't buy healthy foods and often are just struggling day to day. All these things are going to impact on the patients I see. So I can do all I can in trying to help and support and manage a individual's chronic pain, for example, but I can't stop the fact that their bread has increased in price 2 or 3-fold, and as a result, they're cutting back on essential food purchases which they need, or they're having to use food banks. So your health and well-being is not just determined by your own physical functioning, dependent on the society you're living in.